Dabigatran Dyspepsia and Idarucizumab Reversal, Evidence-Based Clinical Guide. Dabigatran is prescribed to 5 million patients worldwide for stroke prevention in atrial fibrillation, yet dyspepsia occurs in is almost equal to 12% of users and can limit adherence. The drug exerts its anticoagulant effect by reversible binding to thrombin, a mechanism that is rapidly neutralized by the monoclonal antibody Idarucizumab. Diagnosis of dabigatran-related bleeding relies on aPTT, thrombin time, and ecarin clotting time, each with defined cutoffs that predict clinically significant anticoagulation. Immediate reversal with 5G Idarucizumab 4, followed by targeted dyspepsia management, e.g., PPI therapy, optimizes outcomes in both emergent and routine care settings. Key points. Note: dabigatran 150 mg twice daily, BID, reduces ischemic stroke risk by 34%, relative risk 0.66, compared with warfarin in the RELY trial, N equals 18,113. Dyspepsia develops in 12%, 95% CI 1014% of dabigatran users versus 5%, 95% CI 46% of warfarin users, RELY. Idarucizumab 5G4, 2.5G boluses less than or equal to 15 minutes apart, restores normal thrombin time, less than 20 s, in 98% of patients within 5 minutes, RE-verse-AD, N equals 503. Major bleeding on dabigatran occurs at 3.6% per patient year, versus 4.1% with warfarin, Aristotle meta-analysis. The aPTT ratio greater than 1.5 predicts dabigatran plasma concentration greater than 200 nanograms per milliliter with sensitivity equals 85% and specificity equals 78%. For CRCL 1530 ml/min, dabigatran dose is reduced to 75 mg BID. For CRCL less than 15 milliliters per minute the drug is contraindicated, AHA/ACC 2023. Idarucizumab cost averages US $3.500 per 5G vial. Cost-effectiveness analysis yields an ICER of US $45,000 per kL gained for life-threatening bleeds. Proton pump inhibitor omeprazole 20 mg daily reduces dabigatran-associated dyspepsia from 12% to 8%, RR 0.53, NNT equals 10. In the RE-verse-AD trial, 90% of patients achieved effective hemostasis, median 4.5 H, after idarucizumab versus 70%, median 12.5 H, with standard care. CHA2DS2-VASC greater than or equal to 2 predicts annual stroke risk greater than or equal to 2.2% in untreated AF. Dabigatran 150 mg BID lowers this to 1.1%. Absolute risk reduction equals 1.1%. Overview and epidemiology. Dabigatran etexylate, ATC code B01AE07, is a direct thrombin inhibitor approved for stroke prophylaxis in non-valvular atrial fibrillation, NVAF, treatment of acute venous thromboembolism, VTE, and secondary VTE prevention. The International Classification of Diseases, 10th revision, ICD-10, code for dabigatran-related adverse effect is Y44.2. Worldwide, 5 million patients were prescribed dabigatran in 2023, representing 18% of all direct oral anticoagulant, DOAC, users. Global Anticoagulant Registry, N equals 28,000. In the United States, dabigatran accounted for 22% of all oral anticoagulant prescriptions in 2022, IQVIA data, N equals 12M. Incidence of dyspepsia, defined as upper gastrointestinal discomfort, early satiety, or epigastric pain persisting greater than or equal to 4 weeks, was 12%, 95% CI 1014%. In the pivotal RELY trial, N equals 18,113 and 15%, 95% CI 1317%. In a 2021 real-world cohort, N equals 4,210. Dyspepsia led to permanent discontinuation in 4% of dabigatran users versus 1% of warfarin users, p less than 0.001. Age greater than 75 years confers a relative risk, RR, of 2.3 for dyspepsia, chronic kidney disease, CKD, stage 3, eGFR 3059 ml/min/1.73 square meter, a RR of 1.8, and concomitant NSAID use a RR of 1.5, multivariate analysis, N equals 9842. Pathophysiology. Dabigatran etexylate is a prodrug converted by hepatic carboxylesterases, CES1, to the active dabigatran molecule, which binds the active site of thrombin, factor IIA, with a dissociation constant, Kd, of 0.5 nanomolar, thereby preventing fibrinogen cleavage. Genetic polymorphism Rs716477871, CES12, reduces conversion efficiency by 40%. Allele frequency is almost equal to 5% in Caucasians, leading to lower plasma concentrations and a 30% reduction in anticoagulant effect. Thrombin inhibition halts the intrinsic and extrinsic coagulation cascades, resulting in prolonged thrombin time, TT, and ecarin clotting time, ECT. In vitro, dabigatran prolongs TT from a baseline of 15s to greater than 200s at concentrations greater than 200 nanograms per milliliter. The ECT, normally 3050s, exceeds 200s at similar concentrations. The aPTT, though less sensitive, shows a ratio greater than 1.5, normal 1.0, at plasma levels greater than 150 nanograms per milliliter. Thank you for watching. For the full article visit MedMind AI at medmind.pro. Like and subscribe for more evidence-based medical content.